Okay, so we're going to get started right away talking about chapter 1. I don't follow along with the PowerPoints. They're good for you to take notes on. I just do a quick overview of each chapter, and if you have more questions, you can definitely email me on them, but I'm not just going to spout out the chapter or the PowerPoints. That's really boring on both ends, and I don't believe in, taking a ton of your time. I really want you guys to get a lot of your interaction through the discussion and the reading. Okay, so public health nursing. What is public health nursing? So public health nursing is getting involved in the community arena and implementing health promotion and prevention. So how do we do that as nurses? Hold on, let me pull up my notes here, sorry. All right, sorry about that. Okay, so public health nursing is what members of society do collectively to ensure that conditions exist so that people can be healthy. We do this through policy development, assurance, through core public health policies, and make sure that they are functioning at a level of government. So, there are state health departments, there are city health departments. I work for the City of Cincinnati Department of Health. I work in a clinic that provides primary care to those who normally couldn't afford it, for those without insurance or with limited insurance. Also in public health nursing, it refers to systematic data collection on the population, which might sound really snoozy and boring, but it's super important to understand how things are trending in the population. For example, in Cincinnati, we have one of the highest syphilis rates in the country. So why is that a high trend in Cincinnati? Is it because there's not enough sex education in the community? There's not enough treatment in the community? Is it because we have a prison nearby? These are things that are really important to understand. The same with tuberculosis. So looking at systematic data collection is very important in community health nursing. Policy development refers to the need to provide leadership in developing these policies, and nurses play a big role in that. There's so much more to nursing than just working in the hospital. Nursing leadership is essential, especially within the community. Most community health workers historically have been nurses. So, all right, so community-oriented practice. In community-oriented nursing practice, the focus is on healthcare. So that's either through community or populations, and public health nursing, or of individuals, families, and groups in the community. So what that means is there's certain vulnerable populations that might be a focus of a community, families or groups, and as a community-oriented nurse, you are trying to target those areas to find the vulnerable issues with health and to help rectify the differences. So that's really important. So a lot of people think that the setting of where a community health or public health nurse works is what sets them apart, but that's not necessarily true, because community health nurses can work in a doctor's office. They're not necessarily at people's houses. Home health does not a community health nurse make. So a really useful approach is using the following characteristics. So it's a focus on population who live in a community, and it's an emphasis on prevention and on promotion. So how can we prevent vaccine-preventable illnesses? Let's go out and see who is getting vaccinated, and as who's getting vaccinated, make sure we're educating properly. Okay. So the goal of public health nursing. The goal of public health nursing is promotion of health and prevention of disease and disability throughout all people, and to create conditions that everybody can be healthy. And that sounds like really kind of, well, obviously we want everyone to be healthy. But as you know, there's going to be discrepancies in health. People who can't read have less likelihood of seeking out health care. People with lower socioeconomic economic status tend to have lower health ratings. Why is that? There's a bunch of derivatives that are involved in it. It's our job as community health nurses to even the playing field with that. Identify the major differences between a clinically focused nurse and a population-focused nurse. So clinical nurses provides direct personal care to clients and encourages health-promoting behavior. Population-focused nursing not just talks to individuals, but identifies subgroups within populations who are at risk for certain things. So anemia. Teen moms, totally at risk for anemia. Why? Because they're getting pregnant when they're 16. Their iron stores haven't developed as a 25-year-old. So they're at risk for anemia. And what happens when you're anemic? You can have trouble breathing. You can have lower developmental rates for future children. So that is a population-focused subgroup in community health nursing. And then challenges that community-oriented nurses will likely face in the future. So new and emerging infectious diseases, and not even new, but emerging ones. So, you know, we pretty much eradicated measles, mumps, and rubella after the vaccine in 1963. It's now popping up in pockets, and, you know, mumps and rubella aren't that dangerous. Rubella is dangerous when exposed to a pregnant woman. It can cause fetal abnormalities, but measles, actually 1 in 500 is fatal, 1 in 50 causes long-term damage, and those aren't numbers you want to play with, right? 1 in 500 chance, that's a pretty good chance that your kid could get really hurt from the measles. So trying to control new and emerging infectious diseases, the need for emergency preparedness. So after Katrina, all these people got sick with the superbug, and New Orleans talked about how they didn't have enough emergency preparedness to take care of so many sick people. Increase in chronic illness management. So people are living longer with diseases, and so managing chronic illness in a population. And then continued reduction of days in the hospital for serious injury. Okay, so now we're going to talk about Chapter 2. All right, so Chapter 2, the history of public health nursing. I'm not going to get into like a ton of this stuff just because you guys all know about Florence Nightingale till you're blue in the face. So looking at the history can help you to increase the understanding of public and community health nursing. Public health and community health nursing are products of various social, economic, and political forces, and it helps incorporate public health science into nursing science. So usually something happened socially, economically, or politically that brought about public health nursing in general, right? The Crimean War with Florence Nightingale. She designed and implemented the first program of trained nurses and organized how healthcare was distributed during that war and then subsequently following. Urbanization and industrialization and immigration in the United States increased the need for trained nursing, especially in the public community and health nursing. So if you look at even just how things were done in how children were born up until the 1960s, were all born at home. And it wasn't doctors coming to the house, it was midwives. And that was organized by community health nursing, specifically in England. So understanding that all the data that gets collected, the education that gets provided, that's all provided by community health nursing. Okay, so we'll go through a few thoughts. All right, so it's important to understand that the influx of immigration in the U.S. during the 19th century and crowding caused a lot of communicable diseases that were problems. And so we needed to have some control of community health so that we could control what kind of communicable diseases were being spread. So there are two types of community-oriented nursing practice that existed in the 19th century. There were visiting nurses and then settlement houses. And settlement houses were kind of like nursing homes. So Lillian Wald established the Henry Street Settlement, and it was the first nursing service provided by an insurance company. She also helped work with the Red Cross to provide rural health services. She established the Children's Bureau and fought for a lot of social and health improvements. So, especially when it came to environmental improvements. So I'm not going to really get into any more on Chapter 2 because it's history. You guys can read that. It's important to know our history to see where we're going. But we're going to go ahead and move on to Chapter 3. Okay, so Chapter 3, we're talking about the U.S. health and public health care system. So, primary care, it's really important to understand the difference between primary care and primary health care, right? So, primary care is, they're both related, but primary care is the essential care made universally accessible to individuals and families. Primary health care is the actual care that can be afforded to the community. Organized community efforts are done through public health nursing. So it's really important to understand that healthcare in the United States is made up of personal care and then public health. Primary care is the personal health care that gets done. First contact, it's continuous. You're seeing comprehensive and coordinated care. So you're having the nurse coordinate, your referral to here and to there. And then primary health care is universally accessible to individuals and families within the community. So primary care is part of primary health care. Primary health refers to the organized community effort that's designed to prevent and promote health. All right, so it's part of it. There's a lot of important trends that affect healthcare, looking at demographics, social, economic, political, and technological. And more than 47 million people in the United States are uninsured. Now, this was published after the Affordable Care Act came out, so it's actually decreasing, but there had to be a change, right? Because our healthcare system was spending so much money dealing with all these acute issues that were a result of preventable or promotable diseases. So diabetes getting out of control is very preventable if you treat it properly in its early stages, specifically kidney failure. So to achieve the specific health goals of programs within Healthy People 2020, primary care and public health must work within the community for community-based care. And the most sustainable individual and system changes come when people who live in the community actively participate. So community health nurses help fill the gap between personal care and public health because they give health promotion, disease and injury prevention, knowledge of community resources. All of that's done by a community health nurse. Okay. Okay. So when we're talking about nursing practice at the local national level, local and public health departments are responsible for implementing and enforcing local, state, and federal public health laws. And federal will always supersede that of anything below it. But it's really important that we have public health services. So public health services help keep communicable diseases reported, and it all depends based on what community you're living in, and making sure things were treated properly, because if someone fell through the cracks, you can have this really communicable disease, i.e. syphilis, going around and it's not being squelched, I mean not sequelched. So the goal of the local health department is to safeguard the public's health and improve community health status. Now, when we talk about community stuff, we always are talking about greater good, right? So it's our job as public health providers to promote vaccinations, right? And there's always these individuals who are like, well, everybody's different. And the idea about vaccination is to immunize everyone so that everybody is safe. And there's risks, of course, with anything you do. And so I think sometimes people forget that. It's all about the greater good. Nursing community health is the practice of promoting and protecting the health of populations using knowledge from their nursing and public health sciences. So, understanding socioeconomic differences is really important when you're planning your education foundation when you're promoting community health practice. So when you're going to go teach diabetic education to a Latino community, talking to them about a diet that doesn't really coincide with what they culturally eat isn't going to make sense. So you say, don't eat hamburger buns. Well, that might not be culturally part of their diet. So they think, oh, I'm following a diabetic diet already. So public health is based on the scientific core of epidemiology, looking at time. And it's our job to inform both professionals and the public about opportunities and challenges that's within the population. All right, so faith community nurses, I'm just going to touch on this really quickly. Cincinnati actually has some really cool faith community nursing, a lot of drives that are done, healthcare drives that are done to check annual labs, mammograms, heart disease issues, blood pressure screenings are done within churches here in downtown Cincinnati. And I'll let you guys read more about this. It's pretty self-explanatory. So home health and hospice. So a lot of people think that when you go on hospice, you're automatically just getting 24-hour nursing care. And that's not necessarily what's happening, and neither is it with home health. Home health and hospice, you're getting nurses out to a home care setting, which could be in the home, a nursing home, and teaching and making partnerships with the support members to take responsibility for the client's care at home. So when you're on hospice, your family is still doing the brunt of your care, but with the proper support. So if you say, okay, I need to help mom get into the tub, and you're able to do it, they will teach you how to do and provide the resources like a Hoyer lift in order to do it. Home health and hospice is actually at quite a turning point with Medicare because the end of life is the most expensive time and people are living longer. So we are at this crossroads right now to make sure people have proper end-of-life care, elderly care as well, and can stay at home as long as possible. How not always the case, right? In-home care, as in other healthcare settings, professionals experience a lot of stress with changing roles and overlapping responsibilities. So when I was an ICU nurse and I went to hospice, and also, when you're in hospice, become a case manager. Well, part of that is social work, and it was really overwhelming to learn all the different things that I never had to worry about, like state laws and who gets covered for what and what gets covered for other things. So that's really important to understand. We're almost done here. School nursing is really important. Nowadays, they have nurse practitioners in schools, and they're offering primary care to not just students, but also to the parents. And then occupational health is kind of the same thing within schools. And it also it's helping to prevent work-related injuries because disability is quite expensive on the American public system. So that's it for week 1 lecture. If you have any questions, please email or call me, and I'll see you next week.